I'm Mrs. Lowe. I am the director of the nutrition program here at ETSU. We actually have two programs in nutrition. One is at the undergraduate level, one is at the graduate level. So I'm the director of the undergraduate program in nutrition, and I'm going to be talking to you a little bit about the curriculum, the admission standards, the program itself, and what to expect with nutrition as a major. So first of all, I guess we need to cover the admission standards. The admission standards for nutrition are similar to those in the Department of Allied Health Sciences in the other programs. So the minimum GPA is going to be a 2.5 to get into the program, and then also to maintain at least a 2.5, preferably higher, during the program throughout. The coursework is also fairly similar to the other programs in Allied Health Sciences, but the difference is that the nutrition program requires 1 full year of general chemistry. So General Chemistry 1 and General Chemistry 2, as well as Anatomy and Physiology 1 and 2, need to be taken in the freshman and sophomore years before a student applies to the program. Now, as is with the case with all of the allied health programs, one of those courses or maybe two of those courses could be in sequence while you're applying for the program. So if you're applying in the spring semester of your sophomore year and you're currently in AMP 2 or General Chemistry 2, then that would be fine. You can still apply for the program even though you're in progress with one of the courses. But General Chemistry 1 and 2, Anatomy and Physiology 1 and 2 are the science prerequisites for the nutrition program. And then in addition to that, you would also want to be sure and have the probability and statistics, as well as the Intro to Nutrition class that we teach in our department, and the Principles of Nutrition course, which is an online course. So those are the primary courses that are prerequisites for admission to the program. Now, once you get into the program, then the coursework really shifts to almost exclusively nutrition and science courses. There's more science courses to be taken during the junior and senior years of the program. So microbiology would be taken in the junior year, as well as organic chemistry. So those two are additional sciences that would be taken by all the nutrition students, as well as biochemistry, nutritional biochemistry, which is taken in the senior year, and it's taught within the nutrition program as well. So that's pretty much what the curriculum is, what the admission standards are, and then the nutrition courses that you would take as far as once you get into the program. There's more than just nutrition courses. There's a lot of nutrition science types of courses which will give you all of the foundation that you need to be able to manage patients with various diseases and that sort of thing, how to prevent diseases or treat them, through nutrition. But also there's one course in community nutrition, because there are a lot of jobs at the community level, and so we want you to be aware of policies and programs that are available to the public, things that, like the school lunch programs, the Head Start programs that have a nutrition component, the elderly nutrition programs. So any of the federal nutrition programs or health programs that have a nutrition component would certainly need to be able to hire a registered dietitian. Then in addition to the basic nutrition science courses, the clinical nutrition courses, community nutrition, there's also going to be food service management courses, because dietitians often will operate within the realm of the food service management department. So within a hospital or a nursing home or a school or something like that. So with that in mind, they have to really know about the operation of the whole food service system. So this is an area that many dietitians end up working in, but all of us need to have knowledge of that. So in order to be a registered dietitian, then we have a basic overall working knowledge of nutrition, clinical nutrition, basic nutrition, clinical nutrition, food service management, community nutrition, and those are going to be the primary components then of careers in the field. With the nutrition program at the undergraduate level, there is not going to be a clinical experience for these students. The clinical experience for the nutrition students will actually come at the graduate level or in the internship. The dietetic internship is a requirement for all registered dietitians or students who want to become registered dietitians. The internships are always offered after the BS degree. So the students in the nutrition program, and this is a little different than some of the other allied health, well, it's different than all of the other allied health programs, but it's similar to the speech language pathology program, the physical therapy program, audiology, and so forth. So the difference is that the students will get a BS in nutrition, and then they will apply for an internship following that, and generally they're associated with a master's degree. The program at ETSU is a combined master's degree program and dietetic internship together. So that is the program that the students would apply to upon graduation in order to do the clinical experiences, have all of the additional coursework that's required before they can sit for the RD exam to become a registered dietitian. So that is the internship, the graduate program, the master's degree. Those are going to be really the culmination of the nutrition program. So the BS in nutrition is the foundation, and then the next step is the internship. Now, those students that don't want to go on and do an internship right away, if they want to take a year off, or maybe they are not interested in an internship and a master's degree, they want to go on and go into medicine, pharmacy, PA school, the physician assistant school, that sort of thing. Those types of programs are also very science-based programs. They're very complementary to the nutrition program. So many of our students will actually major in nutrition, but they're planning to go on and pursue pharmacy, medicine, physician assistant, sometimes physical therapy. So our nutrition program, being such a highly science-based program, is a real good stepping stone for students that want to go into other areas, even speech language pathology. So the prerequisites for other programs could just be taken in conjunction with the nutrition program, and it is really a perfect fit. Now, for other students who want to just pursue a job in the field when they finish the BS degree, that's perfectly legitimate as well. There are positions, entry-level positions for students who have a BS degree. Generally, it's working in public health departments or in a community level, or maybe as a dietetic technician. So those positions would be available as entry-level positions for students with a BS degree. They don't have to go on and get an internship and a master's. They would not be a registered dietitian, though, but they can be a diet tech registered, and they can work at the community level or maybe in a wellness setting, that sort of thing. Now, as far as careers in the field of nutrition and dietetics, there are many, many different facets that students can go into and pursue when they finish their internship program. Now, remember, the internship program provides the students with the opportunity to become a registered dietitian. This is the credential that most all healthcare providers are looking for. So it's the credential that is licensed. It's a licensed registered dietitian, and they're the ones that will provide nutrition care for patients and provide nutrition services and that sort of thing. Many students think of nutrition in kind of a little closed environment. They think of it as far as weight loss or weight management. They think of it as far as preventing diseases and eating healthy and being healthy and all of those. Well, that's all correct. All of that is correct, but it is far, far more than that as well. So some of the jobs and careers that you could have in nutrition would be related to disease prevention. They would be related to preventing obesity, preventing preventing diabetes, preventing heart disease, preventing cancer, managing weight issues, working with patients with eating disorders or something like that. So yes, there are careers in all of those areas, but those are more the wellness types of areas or prevention, disease prevention types of areas. There are also careers and jobs in the healthcare industry as far as working with patients. So in working with patients, that could be in a hospital setting, a long-term care setting, assisted living, and also, again, in a wellness setting as well, like a cardiac rehab sort of a program or something like that. So in a hospital setting, the dietitians, the registered dietitians, or RD as we are known, would be responsible for providing nutrition services to patients who have had surgery. They might be in an ICU setting or be in a NICU, newborn nursery, pediatrics, patients with kidney disease, heart disease, diabetes. All of those are nutrition-related disease states that have a huge nutrition component with them as far as management and treatment of the disease. So whether they're in the hospital or whether they're in an outpatient setting, like, for instance, cardiac rehabilitation, diabetes management is always done at the outpatient level. So any of those types of positions would be available for registered dietitians to work directly with the patients, either one-on-one or in groups, helping them to better manage their disease, to better understand their disease, to have better outcomes overall, so that their disease does not progress into complications and that sort of thing. So we work very closely with those folks and try to help them regain their health and be healthier, even with a disease state or disease course that they have going on, or to maybe help to manage it better and so that it won't progress. So there's many different types of careers working with clinical nutrition, working with patients in a healthcare setting, and that sort of thing. Now, in addition, I mentioned earlier about the food service management opportunities, and of course, anytime you mention management, that's where generally where the larger salaries are, is in managerial positions. So in a food service management of a hospital setting or long-term care or even in a school, those are going to be some higher paid jobs with a lot of responsibility. School systems will often hire one registered dietitian to manage all of the school nutrition programs or the school lunch, school breakfast programs, and they will be responsible for all of the menu planning, all of the purchasing, all of the hiring, the staffing, the personnel issues, and this is true in any of the settings, whether it's healthcare, schools, community settings like the nutrition program for the elderly. It's a complete nutrition program where they deliver meals to patients in their homes or in community settings. So there's lots and lots of different opportunities in that food service management realm as well. So even though a student may think, oh, I'm not ever going to use food service management, that's not my expertise, that's not my passion, we still need to have an understanding of the way it functions so that we can function within that system and we can work within the system to meet the patient's nutritional needs when they're in a hospital or a long-term care setting. So that's kind of an overview of nutrition, of the program itself here at ETSU, of careers in the field, the admission standards to get into the program, the internship program following the undergraduate program, and so forth. So hopefully that will give you a good understanding of the different facets that we can work within. The different practitioners that we work with, of course, are all of the different healthcare professionals in the field. We work very closely with physical therapy, speech-language pathology, dental hygiene, of course, because that's, the entryway to the body, and all of the food has to pass through the mouth. We also work very closely with physicians, of course, with nurses, with social workers, and that sort of thing. So all of the healthcare team members we work extremely closely with and interface with on a regular basis as far as managing our patients and preventing diseases, treating diseases through nutrition and providing nutrition care. Thank you.